Okay, so this is my TRT final. First thing we're going to start with is patient placement. We want to make sure they're centered onto the table and at the foot of the table. We want what would be the shoelaces of the shoe at the end of the table. There would also be a wedge here. Okay, so she looks pretty good. And the first thing we're going to do is the FLR. Okay, so we'll say that her right leg is short. First thing we're going to get her to do is to look to her right. Okay, and we check the legs. If that became even, that would be a wrong un. So you'd be testing for lateral atlas at C1. So we're just going to pressure test lateral to medial on that TP, and then go back and check the legs. Okay, and if that balanced, then we'd go and check for torque, right or left torque, and whatever balance is what you would set your integrator to. And then just on that lateral TP of C1 on the short side, you're going to go straight lateral to medial with or without torque. Just whatever balanced. Okay, and then we're going to get her turned to the long side and then check the legs again. If that balanced, then come back to center. We're going to check for C1, C5 posteriority on the side of short leg. So we're going to go to C1 and we're going to test the posterior TP, just straight P to A, and then check the legs. Okay. And then we would check for torque, either right or left. Whatever corrected, we'd use the integrator posterior to anterior at the posterior TP of C1. Okay, and the next thing we would check is C5. Again, we're going to pressure test P to A, and then check the legs. And then we go and we check right or left torque, and whatever corrected, and then it would be straight P to A on that TP of C5 on the short leg side, which should have both been on this side, on the right side. Okay. Okay, so now we're going to check for bilateral cervical syndrome. Sheila, can you turn your head to the right? Okay, and can you turn your head to the left? Okay, and so what we're looking for with bilateral cervical syndrome is for the short leg to swap when she turns her head to either side. And so first thing we're going to check is for posterior occiput. So we're going to pressure test right below the external occipital protuberance, which is P to A and I to S. And then go back and check. And whatever, if that evens her legs, then we're going to check both right and left torque. Whatever corrects it, we'll go right underneath that EOP, and our line of correction will be P to A, I to S. Okay. And then if she had this adjusted, that would be her last adjustment of the day. Next thing we're going to check for is the coccyx. We're going to pressure test this way. Okay, and say that balanced. First we're just going to palpate for her coccyx. Okay, and we're going to tissue pull. And then we want the integrator to be as low as possible. So our line of correction can be A to P and I to S. Okay, and whenever you adjust coccyx, you're going to adjust sphenoid on the short leg side. Okay, and you're going to pressure test with her face down at the lateral canthus. Do we find? And the coccyx will have no torque, and the sphenoid will have no torque. Okay, so we're going to test. You can go superior to inferior, inferior to superior, anterior to posterior, posterior to anterior. So we'll say this one corrected superior to inferior. Can you turn your head to this side? Okay, so at the lateral canthus, so I like to use my thumb to kind of cover her eye. And then we're going to go straight S to I using my thumb to trigger the integrator. Okay. And again, no torque on coccyx or sphenoid. And the next thing we're going to check for is C5 posteriority. Okay, I'm just going to put straight P to A on the spinous process. And then check the FLR. And then if that balances, you're going to check for torque, right or left. And your line of correction will be straight P to A, I to S. Okay. And then if that doesn't balance, we're going to keep going, and we're going to check C1 posteriority at the posterior tubercle of the posterior arch. And again, just straight P to A. Check the legs. If that balances, you check for torque right or left, and then posterior to anterior, inferior to superior, and that posterior tubercle of C1. Okay, and the next thing will be T6. Okay, and again, pressure test, straight P to A, I to S, and then check the legs. If that balances, then you're going to do check for torque again, and then P to A, I to S is going to be your line of correction. And then finally, for bilateral, you're going to check for a lateral C1 on the side of short leg. So again, pressure test, straight lateral to medial, check the legs, and you're going to check your torque. And then your line of correction will be straight lateral to medial on the side of short leg. Okay, and that's it for priority 2.